Welcome, dear students. Today we are going to learn about a new drug delivery system, and that is Transdermal Drug Delivery System. The objective of this topic is that after studying this subject, this chapter, the students will be able to explain the permeation through the skin. The students will be able to explain the factors affecting permeation. Also, the students can explain about permeation enhancers, and finally they will learn about the basic components of the transdermal drug delivery system and different formulation approaches. The transdermal drug delivery system, under under controlled drug delivery system because it aims to deliver the drug through the skin in a predetermined and controlled rate. Now, because of this predetermined and controlled rate, the drug release can be achieved for a prolonged period of time, and hence we can call this system as controlled drug delivery system. The transdermal drug delivery makes use of human skin as a port of entry for systemic delivery of the drug molecules at a predetermined rate and helps to maintain effective concentration of the drug for a long period of time. So there are n number of formulations available, but still the transdermal delivery, it has got many advantages. Now in oral administration of the drug, it is the most preferred and convenient route, but it has got its own disadvantages. The first disadvantage is whenever a dose or drug is given orally, it should the concentration of the drug, it should fall into that therapeutically effective range. Okay, so if you give a conventional dosage form at that time, after one dose, if you plot a graph of the blood concentration of the drug, then we get a peak and then starts a trough. Okay, so then we give the second dose, so again next peak is observed, and then again as the drug will be eliminated, metabolized and eliminated, there will occur a trough. So because of this peak and trough type of graph, there is a chance that if the concentration goes above the maximum therapeutic range, then it will lead to side effects. And if the concentration is not, it does not fall into that therapeutic window, it does not cross that minimum effective concentration, then there is a therapeutic failure of that dose. Okay, so overdosing, it has to be monitored in this case. Also, the second disadvantage of oral route is the drug which is administered orally, it gives you high amount of first pass hepatic metabolism, which is not desirable because it reduces the amount of drug which will be present in the body to act or to give the therapeutic effect. Also, some drugs, if they are administered, they cause GI irritation. Okay, so to overcome all these disadvantages of oral route, we go for transdermal drug delivery system. Also, the second preferred route is the IV route, but again, IV route, it does not have that patient compliance, whereas in case of transdermal drug delivery system, patient compliance will be very high because this dosage form, it does not cause any pain or any discomfort to the patient. Okay, so because of all these advantages over other dosage forms, transdermal, it is an emerging branch in the field of drug development. So we can say transdermal delivery systems, they are adhesive drug containing devices. They are of defined surface area, and they deliver a predetermined amount of drug to the surface of the intact skin at a programmed rate, so that the drug, it will move into the systemic circulation. So we say that transdermal drug delivery system, it basically, it has got systemic effect. Okay, so transdermal delivery, it is an attractive alternative to oral delivery of the drugs and is poised to provide an alternative to hypodermic injections too. So transdermal has many advantages. So transdermal systems, they are non-invasive and they can be self-administered. The patient, he need not to be much educated about this dosage form. There is no need to educate the patient. He can just self-administer itself. Then the transdermal systems can also provide a release for long period of time, up to 1 week. So they, because of all these facts, they improve the patient compliance and the systems are inexpensive. So this is another advantage. Now let us take a look towards the history. The first ever transdermal system for systemic delivery of a drug was prepared for scopolamine. The scopolamine was released for 3 days, so it was a 3-day patch, and scopolamine is used for the treatment of motion sickness. And this first ever patch was approved by the US in 1979. So a decade later, after that, after first ever patch was released, then came the second patch. It was of nicotine and it was a blockbuster. The FDA has approved till 2003. The FDA had approved almost transdermal patches for almost 13 molecules. So the US transdermal market, it approached nearly $1.2 billion in 2001. So it was based on 11 drug molecules, and these molecules are fentanyl, nitroglycerin, estradiol, ethylene estradiol, norethindrone acetate, testosterone, clonidine, nicotine, lidocaine, prelocaine, and scopolamine. So two new patches are also approved. One is, it contains a contraceptive patch of ethylene estradiol and algestromine, and the second patch, it is used to treat the overactive bladder, and it contains oxybutyn. So now let us see the advantages of transdermal drug delivery system. The first advantage is it maintains a blood constant level for a very long period of time. It avoids the first pass hepatic metabolism, but there is decrease the dose of administration. Then another advantage is there is a decrease in unwanted or side effects. There is increased patient compliance. There is decrease in gastrointestinal side effects. It is very easy to discontinue in case of toxic effects. You just have to remove the patch and you discontinue the therapy. Then there is great advantage for the patients who are unconscious. Then transdermal drug delivery is a painless method. That is the biggest advantage. Then it provides an ability to modify the properties of the biological barrier. Now biological barrier is the skin. So you have a scope to modify the biological characteristics or resistive characteristics of the skin, okay, to improve the absorption of the drug. So for this we use permeation enhancers. Then skin, it provides relatively large surface area of application as compared to the buccal and nasal cavity. Then self administration is easy and possible, and dose delivery is unaffected by vomiting or diarrhea. Now let us see the disadvantages. The drug, it should possess some desirable physicochemical properties to penetrate through the stratum corneum. Also, the drug dose, the daily dose, it has to be less than 5 mg per day. Okay, so if the dose is less than 5 mg per day, then such type of drug is preferred. If drug dose is more than 10 to 25 milligram per day, then formulation of transdermal drug delivery system will be difficult. Okay, because a very baggy patch will be developed and it will have no patient compliance. Then local irritation at the site of application, it might be observed. That might be either due to drug, or it might be due to the interaction of the drug, the excipients and the adhesive. Okay, then there is a clinical need to clearly establish the need of this type of dosage form. The barrier function of the skin, they changes from one side to another, from a person to person, and with age also. Poor skin permeability limits the number of drug that can be delivered in this route. Transdermal delivery cannot deliver ionic drug. That means we can prepare a dosage form for non-ionic drugs only. Transdermal delivery cannot achieve high drug levels in the blood or plasma. Drugs of large molecular weight, they will not penetrate the skin, and hence we cannot formulate a transdermal patch for these type of drugs. Transdermal delivery cannot deliver the drugs in the pulsatile fashion. Adhesion may vary with patch type and also environmental conditions. Now let us take a look to the skin. The skin is this soft and flexible layer, and it covers the body of the animals. So we can say skin protects the internal organs from the external environment. So skin is the largest organ of the body, and it has a surface area around 1.7 meters square to 1.8 meters square. So we can say in an average adult, average person, its skin comprises of 16% of the total body mass. It mainly serves three functions. The first function is protection. Second is regulation, regulation of heat and water content of the body. Then it also helps in sensation. So this is the skin. As you can see, the skin is divided into basically it is the skin is divided into two parts, epidermis and dermis. This hypodermis, it attaches, it is that fibrous layer which helps to attach the dermis to the bones of the body. Okay, now if you observe your epidermis, it does not contain any type of blood vessels. Okay, whereas the blood vessels, the nerves, the sweat glands, the hair follicles, the sebaceous glands, they are present in the dermal layer. Okay, so now we will see in detail about these layers. So basically the skin, it consists of two layers. First is the epidermis. It is the waterproof and it protects against infections. Next is the dermis. It is the location for the appendages of the skin. Now appendages of the skin are hair, hair follicles or your hair, then sebaceous glands, then sweat glands. These are the appendages of the skin. Now let us see what is epidermis. Epidermis is the top layer of the skin and it forms protective barrier over body's surface. Its thickness varies and depends on the cell size and number of the cells. So it might range from 0.8 mm on the palms to about 0.06 mm on the eyelids. So the thickness, it varies from one location to another. It is made up of epithelial cells. It prevents pathogens from entering the body and it also avoids loss of water from the skin. It mainly consists of keratinized stratified squamous epithelium. The epidermis is further divided into 5 layers or stratas. From outermost layer, these stratas are stratum corneum, stratum lucidum, stratum granulosum, stratum spongiosum, and stratum basale, which is also called as stratum germinativum. Okay, so the epidermis, it has got no blood vessels and the cells proliferate by taking up the nutrients which diffuse from the dermis layer blood vessels. Now let us see the 5 layers of the epidermis. The first is the basal layer or the stratum basale or stratum germinativum. So it consists of columnar cells which are arranged in such a way that their axis, they are perpendicular to the skin surface. They continuously undergo mitosis to form new cells which will travel upwards, and as they move upwards, they become little horny. The next is the stratum spongiosum. So here the cell, as the cell is moving upwards, it changes morphologically and histologically. The cell, it gets flattened and the nucleus, it starts to shrink. Then the next layer is stratum granulosum. Here the cells, they synthesize the staining pigment, okay, keratinohyaline, okay, granules. These are staining, they are formed, and these granules, they contain melanin. The next layer is the stratum lucidum. It is anatomically distinct, poorly staining hyaline zone, and it is present on palms and soles. Next is the stratum corneum. This is the most important layer from transdermal drug delivery system point of view. It is the outermost layer. It is considered as the rate limiting barrier, okay, in permeation of the drug molecules. It is almost 10 to 15 micrometers in thickness. Then it comprises of 15 to 20 layers of keratin, and it is filled with corneocytes, and which is anchored in a lipophilic matrix. Now, the cells of the stratum corneum, they are highly keratinized and they are dead cells. So, in the dry state, this stratum corneum, it is almost 10 micrometers in thickness, but it has tremendous capacity to absorb water. When it absorbs water, it swells up. Okay, and the thickness is increased to many times, and it is this portion of the skin which is shaded in a daily life. So around 1 to 1.5 milligram of the skin, the stratum corneum layer, is shaded in a day. Okay, so now let us take a look at the dermis. So it is the layer which is present below the epidermis, and it is made up of connective tissue. It is very vascularized layer of the skin. The dermis, it basically it gives the tensile strength and elasticity to the skin. It contains many nerve endings, and because of this, we can sense the touch, pain, temperature, and pressure changes. Also, it contains hair follicles, sebaceous glands, sweat glands, apocrine glands, and lymphatic vessels are also present here. Now, let us see what are the skin appendages. The hair follicles and the hair, it is one of the skin appendage. The hair, it grows from the follicle, and this follicle is present um, in the dermis or in the superficial epidermis. Okay, so the follicle, um, the hair, it starts and grows from the follicle, from the dermis, and it moves upwards. Okay, so the hair shaft, it comes out of the skin on the epidermis. So the average fractional surface area of this openings is only 0.1% of the total skin surface area. Hair shaft, it consists of mainly keratin. The next skin appendage is the apocrine sweat gland. These are present only in the adults, in the axilla, armpits, and perianal region. It secretes a very small amount of milky oily fluid, which is acted upon by bacteria to produce characteristic body odor. Then is the eccrine sweat gland. These glands, they arise as secretory coil in the lower epidermis, and it exists on the skin surface. It manufactures watery solution from plasma whose output is about 1 liter per day. It functions to assist in the heat control. Next is the sebaceous gland. It is an exocrine gland which is present in association with the hair follicle and secrete an oily and waxy material called as the sebum. The structure consisting of hair follicle, erector pili muscles, and sebaceous gland all together is known as pilosebaceous unit. The main function of sebum is to lubricate the hair and the skin. Now let us see the permeation through skin. For a systemically active drug to reach a target tissue, remote from the site of drug administration on the skin surface, it has to possess some physicochemical properties which are capable of facilitating the absorption of the drug by the stratum corneum. The penetration of drug through various skin tissues, and also the uptake of the drug by the capillary network in the dermal papillary layer. So the rate of permeation, that is dq by dt, across a skin, it can be expressed mathematically by the relationship as dq by dt is equal to ps into cd minus cr. Now here CD and CR, they are the concentration of a skin penetrant in the donor compartment, that is the drug concentration of the surface of stratum corneum, and in the receptor compartment. Now body is the receptor here, okay, and PS is the permeability coefficient of the skin. So there are critically three ways in which a drug molecule, it can cross the intact stratum corneum. It might move through the skin appendages. The path of skin appendages is also called as shunt route, or it might move through the intercellular lipid domains or by a transcellular route. Now, intercellular lipid domain and transcellular route, it is through directly through the skin cells. Now, the physicochemical properties of the molecule which govern the flux of a particular drug to permeate combination of these routes. So the routes are, first is transcellular route, second is intercellular route, third is appendageal route. Now, out of this transcellular route and intercellular route, it is directly through the stratum corneum, whereas the appendageal route is via the appendages of the skin, that is hair follicle, sebaceous gland and sweat gland. Now first we will see what is transcellular route. So by this route, the drug, it will cross the skin directly by passing through both the phospholipid membranes and the cytoplasm of the dead keratinocytes that constitute the stratum corneum. Okay, so this, though even though this path is of shortest distance, the drug will encounter significant resistance. Why? Because the resistance of the phospholipid bilayer, it has to overcome that and then it will move further. Okay, so this resistance is caused because the drug must cross the lipophilic membrane of each cell, then the hydrophilic cellular contains, which contain the keratin, and then again the phospholipid bilayer of the cell one more time. Okay, so this series of steps is repeated numerous times to traverse the full thickness of the stratum corneum. Now suppose this is your skin. The pink blocks are the keratinized cells. So this is your drug molecule in transcellular route. Once you apply the dosage form on the outer part of the skin, the drug, in this case, it will directly move through the cells. So in this case, the resistance will be higher. Okay. Now in intercellular route, what happens, we will see. It is the second most common pathway through the skin. Okay, so here the drug which cross the skin by this route, it must pass through the small space which is present in between the cells of the skin, and because of it the route is tortuous, means it is random, and the path length also increases. So although the thickness of the stratum corneum is only 20 micrometer, here the diffusional path of the most molecules which will cross the skin is in the order of 400 micrometers. Okay, why? Because it has to move around the cells. So the 20-fold increase in the actual path of the permeating molecule greatly reduces the rate of drug permeation. Now again here, this is your skin, this is the drug. Now in intercellular means what? In between the cells, the drug will travel from the spaces which are present in between two adjacent cells. Okay, so it is intercellular. So the drug will move like this. So even though the thickness is very less, but here the drug is traveling more distance. Okay, the next route is the appendageal route. Here this route is also known as shunt route, and it includes the permeation through the sweat glands and across the hair follicles with their associated sebaceous glands. The skin appendages, they provide a continuous channel directly across the stratum corneum. Now in this case, this is the pilosebaceous unit. Okay, now once the drug is applied here, the drug, it will move through the inner uh, lumen of that hair follicle through which the shaft comes. So the drug will move something like this, and then it will go into the blood circulation. So this is the transappendageal route. So the fractional area available for transappendageal route is only 0.1%. The human skin, it contains 40 to 70 hair follicles, that is 200 to 250 sweat glands on every square centimeter of the skin area. Okay, so mainly water soluble substances, they will diffuse faster through the appendages than that of the other layers. So sweat glands and hair follicles, they act as shunt, that is easy pathway for the diffusion through rate limiting stratum corneum layer. The follicular route is important for permeation because the opening of the follicular pore is relatively large, and sebum aids in the diffusion of the penetrant. The partitioning into the sebum followed by diffusion to the depth of the epidermis is the mechanism of drug permeation. So this was all about the skin and route of drug permeation through skin. Thank you for watching.